When they boost your copay, don't you know what to say?
And every Sunday morning I go surfing with several friends, including 3 other doctors and a couple other non-doctors. And of the 4 doctors, 2 of us are conservative Republicans, 2 of us are liberal progressives. One of whom, I'm the vocal one, the other one likes to play devil's advocate with his cards close to his chest. But we've been having a running discussion on healthcare, what the problems are, trying to think of what would actually work to make things better. And we've been having this running discussion for about 14 years now. And I've been getting all my ammunition from the PNHP website for those discussions. So that has forced me to think about things and to articulate things and to learn how to talk to people that are opposed to my point of view. And in 2008, I've been a member of Hawaii Medical Association all along. I submitted a resolution supporting single payer. And because I submitted a resolution, I had the opportunity to get up and defend it and explain how it would work and what the benefits would be. And to my amazement, it passed. I never expected that. I just wanted to make them think a little. And it passed by a large margin. And it is now official Hawaii Medical Association policy. As a result of that, I was asked to run for office. I became treasurer for 2 years, then president-elect, and I'm now president of Hawaii Medical Association. I also wrote an op-ed on why competition among health insurance companies doesn't work to promote health care. Basically, the competition is to avoid sick people, because you're dealing with a large percentage of the population with known health problems, risk factors, things like that. It's like selling homeowners insurance to a community where 1/3 of the population are known arsonists who would burn their house down for money, and another third are potential arsonists. You don't make money by offering a better plan. You make money by avoiding those arsonists or refusing to pay for their houses when they burn down. That's how you make money, and that's exactly the situation with healthcare. So I wrote this op-ed, and one of the state senators called me up and wanted to talk to me, and I told him my ideas on healthcare reform. He introduced me to 2 other senators and told me I needed to do public speaking. I should probably start talking in churches. So I said, okay, I believe in this, I'll do that. I've now given over 30 talks, and it's sort of grown from there. In 2009, there was a relatively small single-payer movement in Hawaii led by a very firebrand woman named Aquan McElrath, who came out of the labor movement and was a fierce champion of social justice. And she had been pushing for single payer for years, and we had a coalition around that. She died in 2008, and she had a lot of connections with the legislature, which is strongly Democrat on both sides. And in 2009, they passed a bill in her honor to create the Hawaii Health Authority, charged with overall healthcare planning for the state of Hawaii, and with designing and running a universal healthcare system covering everyone in the state. And they passed that, and our then Republican governor vetoed it, and they had a special session, they overrode her veto, and it is Hawaii law. However, it was required to be appointed by the governor, which she refused to do. But there was no sunset on the bill. Everybody thought it was dead. But we then elected Governor Neil Abercrombie, who was our congressional representative for many, many years and a co-sponsor of H.R. 676. And he appointed that board September 1 a year ago, and I'm on it. And so we are in the process of trying to design a universal healthcare system for Hawaii.